Hello everyone. As a continuation to my chapter Dysmenorrhea and Disorders of Menstrual Cycle, this is the third video in which we are going to study about the management of spasmodic dysmenorrhea. Spasmodic dysmenorrhea, also called as primary dysmenorrhea, we read about the etiology, clinical features. Now we had to continue with the management protocol of primary dysmenorrhea. A patient comes with you with primary dysmenorrhea. How are you going to manage it? First, you need to give the assurance to the patient that it's not like she need not have anxiety or fear about the disease. Give her assurance. Analgesics and antispasmodic drugs. There are severe uterine spasmodic contractions which are causing myometrial dysrhythmic contractions which are causing pain. To reduce the contractions and to reduce the pain, you need to give the antispasmodic drugs and analgesics. To keep the bowel empty, you need to ask the patient to keep her bowels empty. Encourage normal activities. Since there is severe pain, she is incapacitated, yet after giving the analgesics and everything, you need to encourage the patient to perform the activities. If all this assurance and drugs and encouragement and everything fails, you give them few things. There are two criteria. One, if the patient wants to conceive. One, if the patient wants contraceptives. First thing, let us see if the patient is desiring pregnancy, then there is presence of contradiction of pill, which means the pills should not be given. No contradiction for prostaglandin synthase indicators, which means no contradiction, which means you can give prostaglandin synthetase indicators. The short form for this will be PSI. How many cycles you're supposed to give? 3 to 6 cycles. The Luna and LPSN, this thing I'll be dealing later. First thing you need to remember here is, if the patient wants pregnancy, pills should not be given and PSI should be given. How many cycles? 3 to 6 cycles it should be given. Now on the other side, patient wants contraception, which means she doesn't want to conceive. In that case, there is no contradiction for pills, which means patient doesn't want to conceive, you can give pills. And presence of contradiction of PSI, which means you are not supposed to give prostaglandin synthetase inhibitors. Hope it's very clear to you guys. Patient wants pregnancy, prostaglandin synthetase inhibitors. Wants contraception, give her pill. The oral contraceptive pills, which means it is a combination of estrogen and progesterone, this should be given for 3 to 6 cycles. No contradiction of either. If both of the things you do and yet there are no improvement and still the primary dysmenorrhea continues, which means all this oral contraceptive pill and the PSI is not working, then if it fails, you have to do the USG laparoscopy. We need to find out. In spite of doing all this, it is failing. So there might be a pelvic pathology. The primary might be the secondary might be mistaken as a primary dysmenorrhea. To find out the pelvic pathology, you need to do the USG laparoscopy. In the laparoscopy, uterine nerve ablation. Okay, what you're doing is here, laparoscopy uterine nerve ablation, the nerve is being cut. So there's no more pain. Presacral neurectomy, LPSN, laparoscopic presacral neurectomy, it is rarely done. Dilatation of the cervix is also done rarely. Hope it is very clear. First, give the assurance, analgesics, antispasmodics, ask her to keep her bowels empty, perform daily activities. If all this fails, if she wants pregnancy, give her PSI. If she wants contraception, give her oral contraceptives. If both the things are failing, give her USG laparoscopy, do the USG laparoscopy, rule out if it is primary or secondary. Then in the laparoscopic, then you perform two things. Laparoscopic uterine nerve ablation can be performed, or laparoscopic presacral neurectomy can be performed. Dilatation of cervix is done rarely. Now the medical management, mefenamic acid, ibuprofen, naproxen, COX-2 inhibitors. These are NSAIDs, I guess. You have to give these things as for the primary dysmenorrhea. What are the acids name? The drugs name, mefenamic acid, ibuprofen, naproxen, COX-2 inhibitors. Now the hormones, like we told, we can give the oral contraceptives in case of if the patient doesn't want to conceive. You can give combined oral contraceptive pills, that is 1 tablet daily. The oral progestins can be given. Surgical management, laparoscopic uterine nerve ablation and laparoscopic presacal neurectomy. I have already told that to you guys. So hope it is clear. Thank you everyone.